Afternoon, everyone. My name is Mags Rogers. I'm the Executive Director with the Neurological Alliance of Ireland, and I'd like to welcome you all to this online event this afternoon to highlight the need for a dedicated neurology service for Letterkenny Hospital. You'll hear this afternoon how the current visiting service from Sligo Hospital is not meeting the needs, unfortunately, of the people with neurological conditions throughout Donegal and is placing unsustainable pressure on the neurology service in Sligo University Hospital. The Neurological Alliance of Ireland, which is leading this campaign, is the national umbrella for over 30 neurological charities throughout Ireland. Our event today is part of our 2024 Patients Deserve Better campaign in association with Roche Ireland, calling for local neurology services in 5 regional hospitals across Ireland, including Letterkenny Hospital. What we have at the moment is a postcode lottery, where some regional hospitals have outpatient neurology services and some do not, or in the case of Letterkenny, have an inadequate neurology service on site. And this is despite a clear recommendation in the 2016 National Model of Care for Neurology Service that all Model 3 hospitals, including Letterkenny, should have a properly resourced, dedicated neurology service. I'm delighted to welcome our speakers this afternoon. We have Dr. Siobhan Kelly, Consultant Neurologist with Sligo University Hospital. We have Elaine Cole, person living locally with MS Ireland, and who you may have heard earlier this morning on Highland Radio talking about our campaign. And finally, we have Laura Hardaker, also a local from Donegal, who'll speak about her own lived experience of living with epilepsy and also the need for neurology services close to home. Just a quick housekeeping note, we're delighted that so many of our local elected representatives for Donegal have joined us at the meeting today. I would encourage them to use the chat or Q&A function just to introduce themselves, let us know that they're here. And also if anyone wants to make any comments or any questions for the panel, that they can introduce themselves through the chat. At this stage, I just want to hand over to our first speaker, Dr. Siobhan Kelly from Sligo University Hospital, who is going to speak to the need for a dedicated neurology service in Letterkenny Hospital.
Okay, I'm just going to make sure that everything is working. Can everyone see that?
We can indeed, Dr. Kelly.
Perfect. I'm just going on to slideshow. So thank you very much for asking me to speak here. And this is, I feel, a very important conversation. And what I want to highlight is that this is discrimination by virtue of geography. Just to talk about the neurology services in Donegal. So this is data from 2022, and it mentions about 167,000 patients. Of course, this is not accurate to what is happening. And there are 3 neurologists currently in the last 2.5 years. And we also cover Sligo, West Cavan, parts of Mayo, parts of Roscommon, patients also attending from Longford. We would estimate roughly 500,000 patients. Now, if you were to put that in context of a Dublin hospital with the same number, that would be between 6 to 8 neurologists with all the ancillary staff associated with that, including specialists, registrars, neurophysiology. We don't have any of that. We also have to remember that there's been an additional influx of approximately 5,000 Ukrainian refugees to Donegal over the past 2 years. And many of these patients have very complex medical and neurological needs. These patients take a long time to see. They require interpreters. A lot of the time we're doing interpretation in clinical settings by Google Translate. So a very poor service for these poor people who have come over with a lot of very, very complex neurological needs. And I wanted to highlight that as well. So this is our current service to Letterkenny University Hospital. And we have 1 full day of hospital consults. Now that's a consultant neurologist attending, driving up from Sligo, leaving between 6:30 a.m. and 7 a.m. in the morning, and then doing about 8 to 11 consults. Now on average, a consult will take about an hour. Some are longer, some are a little shorter, but you'd never get anything less than about 40 minutes of a consult. And I think it's very important to note that some of these patients have waited up to a week to see us as well. So they've been sitting waiting for review. We come, we review the patient, we recommend some more investigations. Those investigations have to be ordered. this again delays discharge. So there's a significant delayed discharge associated with not having a neurologist on site in Letterkenny. We also then do a full day of clinic in Scally's practice, which is off-site, and that is one registrar and one consultant on a Wednesday. And then a half-day clinic per week, which is one consultant on Thursday. Rotate this between the three of us. We obviously have our Sligo work when we come back and before we go as well. And when we come back to a full week of consults in Sligo. So very busy service. And it's a 200 kilometre round. So we have to stay up to stay.
Dr. Kelly, if I could just ask anyone who's not speaking to just go on mute. We just have a little bit of feedback from you there, from there on the call. So just anyone who's not speaking, just to go on mute. Sorry, Dr. Kelly, to interrupt you.
No problem at all. Good to go again?
Continue there, go ahead. Thank you, sorry about that.
So knowledge is always power. And one of the major problems that we have is that we don't have time to actually sit down and get the information that we require. But there was a big SAILFA group review of our services some months ago. And so I did actually get some information. And I looked at new referrals to Letterkenny University Hospital Neurology Services from the 1st of January 2023 to the 30th of September 2023. And I also looked at the numbers from Sligo, but with particular reference to the numbers of patients being referred to Sligo who were from what I would call Letterkenny catchment area. And we consider that to be beyond the Lahi line. So we had 412 new outpatient referrals to Letterkenny University Hospital alone. And then of the 523 new outpatient referrals to SUH, 105 were from beyond the Lahi line. Now, if you tripled the number of consultant neurologists, we wouldn't manage to see that number of patients. So what happens in this situation is that only the very, very, very urgent patients can be seen. You're also dealing with clinics that are completely overbooked both places, but we have a little bit more leeway in Sligo. So you end up edging extra patients into the clinics. And only urgent patients get seen. But this means that patients who might be from Carndonagh or Muff or anywhere, you know, very, very far distances to travel have to come to Sligo in order to be seen in a timely manner. And this is happening more and more. Every time I see a referral, I have to ask myself, where am I going to see this patient? And the answer is inevitably Sligo if they need to be seen urgently. And my colleagues are exactly the same. We have approximately 1,000 patients on both waiting lists. So we're talking about 2,000 patients waiting for review for 3 neurologists. And from that time period, from January to September 23, there was 44 patients from the LUH catchment area who were seen in Sligo. We wouldn't have been able to see them otherwise. In terms of outpatients in Letterkenny, we've seen 177 new patients in Letterkenny and 451 return patients. Now, return patients, if I was to just look at return patients and see them in a timely manner, I would have to completely cease seeing all new patients from Letterkenny. It would be impossible for me to follow up my patients on a regular, every 6 months, every 9 months, if I was to do that. So sometimes it is 2 years before a return patient, or longer. It depends on the service. And then even with that, of the 452 Donegal review patients, now these would be people from Ballyshannon as well, 248 of those were from the LUH catchment area. So we're constantly chasing our tail. We're constantly trying to see these patients and having to bring them down, which is not a good service. It's not a fair service. It's not right that patients have to travel. I worry that something might happen to one of these patients traveling. Sometimes the weather is very poor. Just to look at 2 big services, obviously you're aware that there is a disproportionate number of multiple sclerosis patients that are diagnosed in the Northwest versus, we'll say, somewhere like Wexford. There's been a number of studies that have consistently shown that there's approximately 3 times the number of new MS diagnoses in the Northwest than there would be in somewhere like Wexford. And we would definitely agree with this, that we have on average about 3 new diagnoses per month at the moment, most of whom will be from a Letterkenny catchment area. And all of the patients who are receiving the infusions at the moment, these would be people on highly active drugs, people who have progressive MS. All of those are done only in Sligo University Hospital. So to look at our ocrelizumab cohort, which is about 177 at that point in time, this is all from September, and of course has grown since then, 50% of those were from Letterkenny catchment area. And natalizumab, which is for highly active multiple sclerosis, 44% of the 39 patients that we had were from Letterkenny catchment area. That, of course, has grown since then. I would estimate that we have another 5 or 6 patients on natalizumab, and certainly more than 10 or 12 extra on the ocrelizumab at this point. And I think it's important to note that when we're diagnosing patients, apart from when they're inpatients, all of our diagnostic lumbar punctures for patients with MS who are being referred from Letterkenny catchment area are done in Sligo. Any treatments like methylprednisolone, with very few exceptions, are done in Sligo. Any treatments like immunoglobulins are done in Sligo. So all of this involves patients having to travel very long distances to get treatment, which really should be available on their doorstep. If we're looking at the model of care, we're always talking about care delivered close to home. This is absolutely not happening in this circumstance. Just some more additional information. About 41% of our epilepsy telephone advice calls are from the Letterkenny area. And I'm sure I don't have to tell you that there's absolutely no neuropsychology available in the whole of the Northwest, which is just hugely stressful. We have patients who need neuropsychology assessment all the time. I have to say to them, can you afford to go to Dublin where there's a 6-month waiting list to see somebody? And if they can't, they have to go to their local psychology services. And psychology services are wonderful in certain aspects, but neuropsychology is absolutely necessary for patients who have non-epileptic events. And again, you know, this service is not fit for purpose. I also would have to point out that, you know, there's an awful lot of pressure on the Letterkenny system in terms of MRIs. Getting those in a timely manner is very, very difficult as well. You need to know exactly who your patients are. You need to exactly when they're supposed to be getting their scans. We have to follow them up on a very, very regular basis, contacting the radiology department on a very regular basis in order to make sure that scans get done in a timely manner. And this is because there's a huge pressure on Letterkenny MRI as well. And we also do transfers from Letterkenny. So when we see a patient on consults and we feel this person is really unwell and needs to be under a neurologist, we have to organise for transport. That means coming to a new hospital. Most of the time you're talking several days, but we have had patients wait up to 2 to 3 weeks for a bed to come up, especially in, you know, at the moment we're going through a high infection control period. So this is very, what's the word I would use? This is very time consuming, it's expensive, and it's not in the patient's best interest to be sitting on a ward waiting for a neurologist. Now, we are there, but only 1 day a week on the wards. And, you know, a patient who needs to be transferred by and large needs to be seen daily. And I would argue, of course, that Letterkenny, as does Sligo, needs daily neurology cover. There are significant medical legal risks associated with reduced cover. I'm sure that has been shown in numerous studies. And I suppose just to complete my kind of case for discrimination by geographics, there's more than enough work for 2 full-time neurologists, as well as the existing 3 neurologists that are here. We are, to use my word, we're drowning. I feel that the service that we are providing is so thinly stretched that it is dangerous. And that is the reality of Sligo University Hospital covering Letterkenny. So thank you very much.
Dr. Kelly, thank you so much for communicating that so clearly. As you say, your patients are faced with an impossible choice. They're either on a lengthy waiting list to be seen by you in Letterkenny, and I just checked this morning on the NTPF waiting list, there is 779 patients waiting for a first-time appointment in Letterkenny Hospital, neurological patients, and 259 are waiting more than 18 months. And because it's a visiting service, that's an impossible situation for you and your colleagues to be trying to get through that waiting list in a timely manner. And as you say, their only choice is to stay on that waiting list or to make the long journey to Sligo Hospital. And as you say, it's also a question of risk of providing neurology cover in Letterkenny Hospital when the neurologists aren't there, because it is just a visiting service. And that those patients are effectively left without the services of a consultant neurologist, and the staff and other specialties in Letterkenny don't have access to a consultant neurologist on the days when you yourself and your colleagues are not there.
Mm-hmm.
So just in case people can't stay for the whole of the call today, I just want to say that this is a pre-budget ask for the Neurological Alliance of Ireland. This proposal has been on the table for some time, that there should be a dedicated neurologist for Letterkenny Hospital. Dr. Kelly, you've spoken about the forthcoming sale to review, which I think we all know at this stage, ahead of its publication, does recommend dedicated neurology services for Letterkenny Hospital. We're asking for a start to be made on that in this year's budget by earmarking funding for a dedicated neurologist from Letterkenny Hospital. And you've made the very strong case for that this morning. And I want to thank you so much for so clearly speaking to that and the challenges that you're currently facing trying to provide that service. I just want to move now to our next speaker, Elaine Cole, who's a person living with MS who is directly impacted by this situation of having to travel for neurology services. Elaine, if I could ask you to speak.
Yeah, thank you, Max. I've been living with MS for 17 years. I travel between 5 different hospitals: Letterkenny, Sligo, Manorhamilton, and 2 in Dublin. And that's 1 out in Loughlinstown for medical appointments. And 1 month I have 3 appointments. I go to Sligo, Manorhamilton, and Dublin, all different places on the 1 month. My husband has taken me to appointments. The public transport is not option due to my mobility, taking annual leave from his work, the cost of travelling long distance regular for appointment places, huge financial strain on patients and their families, the fatigue from travelling, treatment. I just would love to see neurologists in Letterkenny Hospital. This has gone on 17 years since I was diagnosed. And if it's not happening today, tomorrow, next month, we really need our government and our TDs, councillors to help us out. Please support us.
Thank you, Elaine. I think you've spoken very powerfully there of the impact on your life. I just say this is 17 years. This is constantly to and fro for neurology services. And as you say, it's just one of a number of services that you need living with your MS. But certainly if there was a neurologist available locally in Letterkenny Hospital, it would just make so much difference to you and so many people like you throughout Donegal.
100%, yeah.
Thank you so much for speaking today. And I know you've spoken earlier on local radio this morning to highlight this as well. Dr. Kelly, we just have a question in the chat, if I could bring you in quickly, just in relation to cross-border services. Are people travelling cross-border to get neurology services, or is that an option for people at all?
Anyone who has private insurance, quite a proportion of them will have attended Ballykelly, for example. But the services in the likes of Altnagelvin are still under development in terms of the MS services, as far as I'm aware. We're not very familiar with the cross-border initiative. Somebody had mentioned it to us recently, but it's not something that we come across very often. Most of the time, this is initiative of the patient themselves.
And I think if the waiting lists are so long, it's an indication that people are reliant on the Letterkenny and Sligo services, that obviously the cross-border option is not really realistic for these patients if so many are sitting on waiting lists at the moment. It just shows the need for the service. We just had another quick question, Dr. Kelly, sorry to bring you in again. Just if there was an additional dedicated neurologist available in Letterkenny Hospital, I suppose how effective would that be in reducing waiting lists? I suppose it's kind of an obvious question, but just if you have any kind of information on timeframes of that, of how much they could get through in terms of waiting lists compared to what you and your colleagues can realistically get through at the moment.
So it's an obvious question, but there's an obvious answer as well. You need resources. So if I was to speak about our 3rd consultant colleague, she was not able to start clinics for over a year and a half after she came because of reduced clinic space and the inability to have clinic space. So you need space, you need a support team, you need MS nurses, you need epilepsy nurses, you need all of these kind of services, but they have to come from somewhere. And I suppose I can only speak from my own experience. In my first year as a consultant neurologist, I saw 270 new patients in Sligo. I know that because somebody told me. So, you know, and that is, you know, that's still nowhere near the number of referrals that we've got in a, 9-month period. But still, if you added 2, and we would obviously strongly advocate for 2 consultant neurologists, and of course, very strongly linked with Sligo as well, because they're going to need support in terms of EEG, which we do have here. We don't have neurophysiology. We have to send our patients either to Dublin, to the Hermitage, with a thing called an order number, which comes from the hospital, is paid for by the hospital, or one of our excellent colleagues, Dr. Michael Hennessy, also facilitates the more urgent ones. But that sort of service all needs to be looked at, and I suppose in an ideal world, you would look to see that all of this was set up. But I know nothing happens quickly. So realistically, what would happen if you got 2 neurologists tomorrow? They would significantly improve the lot of patients who are inpatients. They would probably significantly reduce the waiting time for patients to stay in hospital. Because as you know, some of these patients are waiting a week at least, because then we order other investigations that take more time. So some of these patients could be 2 or 3 weeks in hospital waiting for investigations after seeing us, you know, and that is the reality of it. And then with the property resource service, obviously, you know, you would have a very independent Letterkenny service, but still linked to Sligo. I think we would all be very clear that we would absolutely want the link to stay in Sligo. And I don't think there would be any question of us, you know, removing ourselves completely from Letterkenny. We have a lot of patients already, as you know. But I don't think that it is realistic that we can keep up with the demand, with the service that we are providing in so many places. Now, I hope that's a reasonable answer.
Absolutely, absolutely. I think what's becoming so clear from this morning, from your own testimony, from Elaine's testimony, is how long this situation has been on the go of the service, the already overstretched service in Sligo, trying to provide this skeleton outreach service to Letterkenny, and that it's just absolutely not sustainable. And I say, hence our call for that funding in the upcoming budget. And I suppose just to make it clear that this is people are seeing a neurologist long term. This is not a once-off appointment that people see a neurologist, they're off a waiting list, job done. These are chronic, long-term conditions that, as Elaine said, people will live with for a number of years. They need to be seeing their neurologist frequently. So we're talking about, you know, first-time appointments to see a neurologist, but just to make it clear, people will be seeing their neurologist for a number of years. This is building up in terms of waiting lists. It's not just the new appointments, but it's also, as you say, seeing people again and again for their annual reviews, whatever, and all of that contributes to the demand on the service. I'm just keeping an eye on the chat here. Just in relation to people, you know, people are in the chat saying they're traveling as far as Dublin. I see one example there for services. And just to say that is the only option for people if they can't be seen in Letterkenny, if they can't be seen in Sligo. They're either sitting on waiting lists or they're trying to get private appointments. I'm just conscious maybe of bringing in our final speaker, Laura. Laura is going to speak about her experience as a person living with epilepsy, and just the impact on her, and just being so conscious of the need for these services locally for people with neurological conditions. So Laura, if I could ask you just to join us here.
Yeah, thanks, Max. Yeah, it's been really interesting listening to everybody so far as well. So my name's Laura. I live in Bundoran in South Donegal, and I've been living with epilepsy for just about 18 years now. So I experienced my first seizure as a generalized tonic-clonic seizure, and I was actually outside of the country. I was in the US at the time. So when I returned to Dublin, well, I was in college in Dublin at the time. I'm originally from Limerick. I wasn't, because with the support of my family at that time, I spent a bit more time at home in Limerick, and the closest neurologist I could get at that time was in the Bon Secours Hospital in Kerry. I wasn't given an immediate diagnosis of epilepsy because I had just had one seizure. And unfortunately, about 3 or 4 months later, I experienced another tonic-clonic seizure, and I've had the diagnosis of epilepsy since then. As I was in college in Dublin, I was quite well, I was slow, I suppose, to look by myself for a neurologist there because, well, I was just aware that waiting lists for so long, even in Dublin. So I continued to travel from Dublin down to Kerry during that period of my life in my college years and throughout the time that I lived in Dublin. So the epilepsy didn't improve, didn't necessarily disimprove. I was suffering or experiencing generalized tonic-clonic seizures. And at that point, the treatment, well, the only treatment that I was aware of and the only treatment that I was being offered was medication, which didn't control the seizures fully. And I was still experiencing tonic-clonic seizures at least annually. And when I moved to Donegal, well, my personal life brought me to Donegal about 9 years ago now. And I started to seek a neurology service close to where I am. And I did manage to see one of the amazing consultant neurologists in Sligo, excuse me. And as I suppose my condition progressed and I progressed, it was only in Sligo that I became aware actually that there are other types of seizures. You know, everybody seems to think there's this kind of general view of epilepsy as, oh, that's somebody who's having a convulsion, that's somebody who's going to fall down. And, you know, you still have there's still such a lack of awareness by the general public, I mean, about how to view a person with epilepsy or what to do if they witness a seizure. But like I said, it was only when I was speaking to one of the specialist nurses, the epilepsy nurses in Sligo, and she asked, well, have you ever experienced any other type of seizure? And I said, well, what's that? I wasn't aware there were any other types. And when we started speaking and teasing it out, we realized that I was having focal seizures with impaired awareness. I opened my own business in Bundoran, in Donegal, and I suppose with the stress of running my own business, these became more and more frequent. As far as I was concerned, and the neurologist I was seeing were concerned, the condition was, well, it was worsening. What we were doing was just increasing the one type of medication that I was on, and with very little positive impact on my condition. So I did get, I was advised outside of Sligo that I should start looking elsewhere. Should I start going to, should I look in the UK for alternative treatments or, you know, a better service? And I'm not saying that I haven't had anything but an extremely positive experience with the neurology team in Sligo. But at that point, I started seeing a consultant in Beaumont Hospital. The next step was to try another medication, and as the focal seizures continued, even on 2 medications, I was then diagnosed with drug-resistant epilepsy. And just for anyone who isn't aware, because like I said, most people's view of epilepsy is, oh, a generalized tonic-clonic convulsive seizure. But my seizures would have been less dramatic than that, but at the same time, the impact that having the condition has had on my life has been no less, well, it hasn't been of any less of an impact in terms of my independence. And even as Elaine was saying, you know, coming back to, okay, what this is about is the dire need for a consultant neurologist outpatient service in Letterkenny. For me, as somebody with my neurological condition is epilepsy, but anybody with a neurological condition, your independence is going to be compromised. And for me, that's travel, but that's the same as Elaine was saying. You know, I would have to get family or my husband or, supportive members of my extended family to bring me to consultations, whether that is Sligo or Dublin. As Elaine said, taking days off work, both myself and my husband, for round trips to hospitals around the country. And it has to be done. You know, you don't have any option. You can't, yeah, just, it's necessary, and you might have to wait, you might have to travel, you might have to incur extra expense because the service isn't local to you, but you just have to do it. And as Elaine was saying as well, in terms of scans, you know, I was asked several times over the years, could I go privately for my scans? And I had health insurance that would cover those most of the time. But the reason that I was being asked to go to private hospitals was because the waiting list was just too long in other hospitals and they would have, you know, my neurologist would have needed scan results sooner than I would have been able to get them in public hospitals. So, I mean, with my own story, I continued to have those focal unaware seizures on 2 medications then, and it was only when I went to Beaumont that I even realized or was ever told that the only other option really, after trying several different medications, when you're essentially given a diagnosis of drug-resistant epilepsy, the next option to explore is surgery. And I had never even heard of that before. It's obviously a program that's only offered in Beaumont Hospital. And that was about 7 years ago that possibility was first raised for me. And throughout the years since then, there's been, so the first step towards that was being put on a waiting list for video EEG monitoring, again, which only happens in Beaumont Hospital. There are only 4 beds in the hospital. The waiting list, I was told at that point, was a minimum of 2 years. But then, unfortunately, as COVID hit and waiting list just got longer and longer, and I was finally called for the video EEG monitoring in January of 2023. So that was about 5 years after I had been put on the waiting list for that. Luckily, that was a positive experience in that they were able to capture enough seizures on the EEG to localize the epilepsy focus to my right temporal lobe. And from then, it was a year, at least a year of further scans of neuropsychology services, neuropsychology appointments. And all of that had to be done in Dublin as well. I mean, I wasn't even aware until Dr. Kelly said that there are no neuropsychological services in the Northwest at all. That's really shocking to me. And luckily I did have an excellent experience with all of those services in Beaumont, but I do live in Donegal, and I had to make the journeys to Dublin every time, very frequently. My own experience of my condition, it continued to get a little bit worse. The medication dosages were being increased and increased all of the time without any impact on the type or the frequency of my seizures. I was very lucky though in the meantime to have, well, since originally being put on this waiting list, and finally getting that video EEG monitoring in Beaumont last year, I've had 2 children, and I have had excellent support from Sligo throughout all of that. Well, from maternity services and also the neurologist that I was seeing there.
And not to interrupt you, sorry, Laura, just, you know, your care was very specialist, and I'm delighted, you know, you're so brave coming in this morning and talking about what is a really, really intensive, serious surgical procedure. You had to have that in Dublin. That's completely understandable. It's a very specialist type of surgery. But I suppose, what you've spoken about as well is for yourself and thousands of people like you throughout Donegal, that they would at least have that first point of contact of being able to see a neurologist locally to pick up on their symptoms and direct, if you have to travel outside of Donegal for a special service, so be it, but just to have that basic access to a consultant neurologist locally in Letterkenny, that would be so important for the likes of people like yourself and Elaine.
Yeah, absolutely. I mean, for peace of mind as well, that where you live, you have the peace of mind or even the feeling of support. Okay, my country or our health service supports me, even though I live in Donegal. Like you said, just because you live in what is in many ways an underserved part of the country, not just from a health service perspective, but like I've said, public transport. Yeah, I think there is definitely a need to feel like in your locality, you can be supported no matter what your condition, and that you're not just put on a waiting list for somewhere that's really not practical, and just not fair for a patient to have to travel. Obviously, like you said, when I started going down the surgical route, yes, it's extremely specialized, and I know that Beaumont was the only option for me. So I'm not saying that should be an option, but basic neurology service, first point of contact, exactly first, which is, I mean, for me, at least remembering back to when I had my first neurology appointment, that's the most important, really, is that initial point of contact, your initial exploration into what could be a condition that you have to live with for, well, the majority of your life, maybe the rest of your life. So to know that you have a local support there that's available, that you don't have to, that you're not, well, like we already raised all of the issues that people come up against because they don't have a service locally. So
absolutely. And you have made, an incredible, I say, your courage in coming on this morning and just talking about your experience of surgery, of epilepsy surgery. And as you say, it is a fantastic specialist service that is available here in Ireland, in Dublin, but just that we need to get the basics right as well. We need to have neurology services available, in the properly resourced neurology services available in the Northwest. I want to sincerely thank all of our speakers this morning for making this point so clearly. We cannot continue to have a situation where there are lengthy waiting lists and there is an absence of frequent neurology cover in Letterkenny Hospital, where the service in Sligo is completely overstretched, trying to continue to provide that skeleton service to Letterkenny Hospital. Our campaign will lead up right to this year's budget, calling for funding to be dedicated for a dedicated consultant neurologist for Letterkenny Hospital. If anyone hasn't already visited our campaign website, you can do so at www.patientsdeservebetter.ie, where you can contact your local TDs and let them know, and use your voice locally to campaign for change. I would like to thank all of our speakers for making the case so strongly this morning, for Dr. Siobhan Kelly, Sligo University Hospital, for Elaine Call, and Laura Hardiker locally, for giving their testimony and their own personal experience this afternoon. And from myself and from everyone at the Neurological Alliance of Ireland, to our elected representatives joining us, please support our campaign for a dedicated neurologist for Letterkenny Hospital in this year's budget. Thank you, and thank you for joining us.
Thanks.